Hello, we have a client, Mrs. Smith. She's presenting with halitosis, gingivitis, no recession, good dexterity, no embrasures, tight contacts, a sensitive gag reflex, and she will also be needing an oral cancer screening. In this video, we will be providing Mrs. Smith with some demonstrations and recommendations to better assist her with her oral health habits. For our client, I'll be demonstrating the Bass toothbrushing technique. So with this technique, you'll want to angle your toothbrush at a 45-degree angle into the gingival and gentle pressure, back and forth motion for about 5 seconds per tooth. Like so. This technique is used for clients with no recession and good dexterity. And we'll do that on the bottom. So make sure you cover each tooth for about 5 seconds.
Hello, Mrs. Smith. From our talk earlier, you said that you wanted me to explain and demonstrate flossing with you. That's great. It can help with your swollen gums and get in tight areas to get rid of plaque and debris. I know a good method and specific type of floss that would work well for you to floss daily. Let's get started. The type of floss that I will use is number one, doctor recommended brand from Oral-B called Glide Pro Health Comfort Plus. That slides 50% more easily into tight spaces. You can buy this at Shoppers Drug Mart for $6.97. The method of flossing that I feel is best for you is the spool method. You take about 18 inches of floss and wrap it around your middle finger. Make sure you don't go too tight to change the color of your finger. You might cut off the circulation. And if you do, you'll just have to start all over again. So you wrap most of the floss on the one finger and then just a little bit on the other finger. The floss in between, you'll use your index fingers to guide in between the spaces of your teeth. And then when you're ready to do the next tooth, you wrap the dirty one on the one finger and the clean one on the other finger is released. So you'll have clean floss. Make sure that you floss in a sequenced manner so you don't miss any teeth. You can either start from front to back or back to front. You'll start with a rocking forward and seesawing motion to get into the tooth back and forth gently so it doesn't bash into the tooth and bash into your gums and cause tissue damage. So you want to make sure it's slow, controlled downward pressure or upward pressure depending on which tooth you're working on to go into the gums. So you go seesaw in, and then you want to go around the tooth into a C motion. So you'll have a C shape on the tooth, and then you'll go up and down on the tooth about 3 or 4 times, and then you slowly come back the seesaw motion again out, and then you go to the next tooth. Then until your whole mouth is complete, and you can do this daily. I got my floss, 18 inches piece approximately. I'm spooling it around my middle finger lightly so it doesn't change color or be too tight around my finger. Mostly on one side and a little bit on the other. I'm going to use my pointer fingers for control. And then each time I floss in between the teeth, I'm going to spool on the other side and let loose on this side so I have a clean piece of floss. I'm going to go back and forth gently and controlled and slow as to not make any tissue damage. Do a C around the tooth. Go down and up. Down and up. Down and up a few times, and then seesaw out gently. Then in a sequential manner, Change the floss, get a new piece, make sure it's the clean side. Go to the next tooth. Seesaw, gently and controlled, going down, not too hard so you don't make any tissue damage. See on the tooth, up and down, up and down, up and down, then gently seesaw out. Change to the next tooth, change the floss until all your teeth are done. And do that daily.
Our patient is also presenting with halitosis, so we're going to want to inform them on the causes of halitosis. 80 to 90% of halitosis is due to poor oral hygiene habits, such as tongue coatings, which accounts for 43% of all cases of halitosis. Our tongues inhabit a large amount of bacteria, which needs to be removed on a consistent basis. This large amount of bacteria presented on our tongue is one of the main causes of the malodor. So to remove this, we would need products such as a tongue cleaner. You can purchase a tongue cleaner in stores for approximately $4 to $6. You can also use a manual toothbrush or a specific head on a electric toothbrush. So I will be demonstrating how to use the tongue cleaner for our client. For those who have a sensitive reflux, you're going to want to start with the lateral edges of the tongue. So you're going to stick out your tongue as far as you can and scrape from as far back as you can. Try not to activate that gag reflex and scrape downwards, starting with the edges and working your way into the center as far back as you can. The tongue cleaner is also a great option for our client who presents with a sensitive gag reflux, as using one on a regular basis inhibits the gag reflex. So the more you use it, the less sensitive your reflux will become. So tongue cleaning is one option to remove excess bacteria on the tongue that may be the cause of halitosis. Another possible cause is xerostomia. That would be dry mouth. So products for recommendation for my client, I would recommend gum hydrogel or spray. So this is not a saliva stimulant, it's just dry mouth relief. The cost of this product is $20 to $25.
Hello, Mrs. Smith. From our discussion, you want me to show you how to do your monthly oral cancer screening. It's important to be aware of changes in your mouth. It's best to do this in front of a mirror. There are 7 steps. First is your tongue. You want to stick your tongue out, and it's best to do this in front of a mirror so you can see. You can stick your tongue out and hold it with a cloth. With your other hand for grip, and move it from side to side to check for abnormalities, bumps, red or white patches. Then do the same for top and bottom. So for example, second is lips and cheek. Lips. Look around the edges of your lips. Look for any sores or lesions. Use your thumb and index finger to check the upper part of your lip and your lower part for any abnormalities. You can look to see for any white or red patches or lesions. For example, your upper, your lower, your cheek. You want to use your index finger and your thumb and pull back the sides of your cheek, both sides. Again, look and feel for any abnormalities, red or white patches. So you pull back your cheek, both sides. Number 3 is floor of the mouth. Raise your tongue to the roof of your mouth and look under it to see any abnormalities, bumps, red or white patches. Number 5, head and neck. Using all 4 fingers, rub in a circular motion to feel any lumps, bumps, or tender areas in the front and in the back and in front of your ears. Number 6, say ah and use a depressor. You can use a depressor, a stick, or a teaspoon, and press down on your tongue so you can look at the back of your mouth, and you can again look for any abnormalities in bumps or red or white areas. And here's an example. And number 7, tell someone if you do see any abnormalities, any lumps or bumps or red or white lesions. Tell any health care professional or your oral health care professional. Early detection is key. All right, Mrs. Smith. So we discussed earlier about the oral cancer screening, and I'm just going to demonstrate for you here on this mouth here. So there's 7 steps. So first, again, we're looking for abnormalities, any bumps, redness, or white patches that we're going to be looking and feeling for. The 7 steps are tongue, lips and cheek, floor of the mouth, roof of the mouth, head and neck, and then the back of your mouth when you say ah. And the 7th step is telling someone if you do have abnormalities. Okay, for the tongue, you would stick your tongue out, and you can hold it with the cloth to grab to get traction. You can move it from side to side and looking, and you can feel also on the side if you feel any abnormalities. You can do it on the other side, and then you look and feel on the top and the bottom. The lips and cheek, you can look all over on the outside. You can look on the inside, see if you see anything, and then you can feel. If you feel anything, you can look if you see anything, and then you can feel. You can look at the floor of the mouth. You can raise the tongue and look at the floor, see if there's any abnormalities. You can look and see in there under the chin. See if there's any bumps. The roof of the mouth, you can rub, you can look at the roof, look in to see. You can feel if there's any bumps or abnormalities, white patches, red patches. Head and neck, you go in circular motions of all around the neck, in front of the ears, all in the back. Say ah, depress the tongue, look in the very back of the mouth. And then if you see anything, you have to tell your oral professional if you find any abnormalities. Early detection is key.
So for our patient presenting with gingivitis, I would recommend, along with proper toothbrushing techniques, such as the Bass toothbrushing technique, to use Crest gum detoxifying dentifrice. This can be purchased in stores for approximately $6.50. The active ingredient would be stannous fluoride. So you're going to want to use this twice daily, a pea-sized amount. Along with the dentifrice, I would recommend a oral rinse such as Listerine Total Care. This product reduces bacteria in the mouth, which causes bad breath, for up to 12 hours. It also reduces and prevents gingivitis. So you're going to want to rinse with 20 milliliters twice a day. You can purchase this in stores for approximately a larger bottle, $5 to $12 in store. Another rinse I would recommend is Crest Gum and Breath. This product reduces inflammation and prevents halitosis. So for clients needing a stronger product, I would recommend chlorhexidine. This is a prescription product, and it's also the gold standard among hygienists. This is also recommended for high camber clients. To use this product, you would rinse with 15 milliliters for 60 seconds once a day for 1 week out of each month. We would also want to inform our clients of possible side effects such as tooth staining, taste alterations, and excess calculus formation.